The fluorescent lights hummed their flat electronic song above the pediatric corridor at Oak Creek Memorial, and Elena Martinez moved through them like she was trying to leave no trace. Her civilian scrubs were navy blue, unremarkable, the kind that blended into the background of any hospital in America. Nobody looked at her twice. That was intentional. The faded unit patch sewn inside her jacket lining, the only piece of her old life she'd kept when she drove into Norfolk 3 years ago, pressed against her ribs like a secret she'd buried so deep that even she sometimes forgot it was there. The smell of antiseptic hung in the air, sharp and chemical, mixed with something underneath it that never quite washed away. Copper. Sickness. Fear. Elena catalogued it all as information, the way she always did. The way she'd been trained to do. Her hands were steady as she reviewed the morning chart for room for 17, her fingers, marked with old scars that caught the hospital lights in thin white lines, tracing the notes from the previous shift with practiced efficiency. 7-year-old. Admitted 3 months ago. 14 follow-up appointments. 20 different physicians consulted. No diagnosis. No improvement. Only deterioration. The girl's name was Maya Reeves. Her father was Captain Michael Reeves, Navy, stationed at Naval Station Norfolk just 8 miles from here. Elena didn't know why she registered this detail, why it stuck in her mind like a piece of shrapnel. She pushed it aside. There were 4 other patients on her rounds this morning, and Maya was just one of them. But when she stepped into room for 17, something in her posture changed. Not noticeably. Just a fractional shift in her weight, a slight tightening around her eyes. The kind of thing nobody would catch unless they knew how to look for it. Maya sat propped against 3 pillows, her small frame dwarfed by the hospital bed. She was pale, not the pale of simple illness, but the pale of someone who hadn't seen real sunlight in weeks. Her lips had a faint blue tint at the edges. Her breathing was shallow. The heart monitor traced its steady rhythm across the screen, but Elena's eyes moved faster than the data, cataloging what the numbers didn't say. Slight tremor in the girl's left hand. Discoloration on her fingernails, a faint greenish cast that belonged to no common childhood disease Elena had ever treated. "Morning, Maya," Elena said quietly, approaching the bed with the same calm demeanor she brought to every patient interaction. "How's your pain today, on a scale of 1 to 10? 3, Maya whispered. Her voice was thin, almost transparent. "But I'm cold. Even with all the blankets." Captain Reeves stood by the window, his uniform crisp and pressed, his jaw working like he was chewing on something nobody else could taste. 3 months of watching his daughter fail. 3 months of doctors offering theories that led nowhere. Elena could see it in the set of his shoulders, the specific exhaustion of a man trained to command who'd been left completely powerless. Elena placed her hand on Maya's forehead, feeling the temperature there. Normal. Too normal for someone showing signs of systemic failure. She moved to the 4 line, checking the infusion rate, watching how Maya's small body was processing the fluids. The needle tracks on the child's inner arm showed that she'd been poked repeatedly, tested, drained. 20 doctors. That meant 20 different hypotheses. That meant nobody had actually looked. She pulled back the thin hospital blanket and examined Maya's extremities with the deliberate thoroughness of someone running a diagnostic scan. The discoloration wasn't random. It followed a pattern. Fingertips. Under the nails. A slight darkening along the cuticles. Her mind moved through the architecture of toxins, heavy metals, environmental exposures that accumulated slowly enough to fool the screening tests but showed up in the physical body if you knew what to look for. "Has Maya been experiencing any numbness?" Elena asked, her voice still quiet, steady. "In her hands or feet?" Captain Reeves turned from the window. "Yes." The neurologist said it was probably anxiety-related. Elena's hand paused for exactly half a second. Then she continued her assessment, moving methodically through the rest of the examination. Her mind was already 3 moves ahead, cataloging variables. The captain's dress uniform bore the naval insignia of a commanding officer. His daughter was failing in a military town. Naval Station Norfolk housed 75,000 personnel, which meant 75,000 families living in base housing, which meant infrastructure that was sometimes decades old. "I'll make a note of that," Elena said. She didn't say anything else. She'd learned long ago that the only opinions that mattered in a hospital hierarchy were the ones with medical degrees, and she'd buried the part of herself that had ever thought she had a right to one. She finished the vital signs and stepped back from the bed, making her notation in the chart with quick, efficient movements. Base housing. Old pipes. Water quality. Environmental contamination. The pieces were there, scattered across 3 months of medical notes like puzzle fragments from different boxes. But you had to know how to look. You had to have seen it before. You had to have treated children in places where the water turned their skin the color of old copper, where their systems slowly accumulated what they shouldn't have been breathing. Elena had seen it. In Kandahar. In the camps. In the aftermath of the places where her old life had ended. She was about to leave the room when Dr. Sterling appeared in the doorway. He was tall, silver-haired, the kind of man who'd learned early that confidence could be weaponized. His white coat bore the title of Chief of Medicine, and he wore it the way other men wore armor. Behind him came 2 resident physicians, both holding tablets, both looking exhausted and uncertain. "Good morning, Captain," Dr. Sterling said, his voice carrying the warm authority of someone accustomed to being right. "I wanted to check in on Maya myself. We're running some additional metabolic panels this morning. I'm fairly confident we're looking at a rare genetic syndrome, possibly mitochondrial in nature. The presentation fits the diagnostic criteria quite cleanly." Elena moved toward the doorway to give him space. She kept her expression neutral, professional, the mask she wore in every interaction with the hierarchy that ran this hospital. "Dr. Sterling, Captain Reeves," she said quietly. "If there's anything else Maya needs, just signal for me." She was already past him, already 3 steps down the corridor toward the nursing station, when she heard Captain Reeves ask a question in the room behind her. She didn't stop walking. She'd learned that lesson too. The morning continued in the rhythm Elena had constructed for herself. Patient care. Documentation. The 1,000 small tasks that made up a nurse's day. She didn't think about Maya's fingernails. She didn't think about the blue tint at the girl's lips. She didn't think about the pattern of symptoms that didn't match any genetic disease she'd ever read about in a textbook, but matched something else entirely. Something she'd seen before. Something she'd treated in a place 3,000 miles away and 8 years ago. Around 10:19 a.m., Elena took her break in the small staff room on the pediatric unit. The room smelled like stale coffee and the faint ghost of someone's microwaved lunch from yesterday. There was a small locker where she kept her things, including the jacket with the faded unit patch sewn carefully into the lining. She kept the jacket with her at all times, even though she never wore it. It was the only thing she'd allowed herself to keep. She'd learned not to ask questions. She'd learned not to suggest diagnoses. She'd learned not to challenge the doctors, no matter what she saw. She'd walked away from a world where she was trusted to make life and death decisions, where people called her by her rank and followed her orders without question. She'd walked away because staying there meant seeing Kandahar every time she closed her eyes, meant hearing the rotor wash every time a helicopter flew near enough to rattle the windows, meant feeling the weight of every person she couldn't save pressing down on her like a physical force that would eventually crush her entirely. So she'd chosen this instead. Invisibility. Erasure. A name and a job and a small apartment in Norfolk where no one knew what she'd been. A faded unit patch hidden in the lining of a jacket. The only piece of proof that Senior Chief Petty Officer Elena Martinez had ever existed at all. She pressed her hand against the jacket, feeling the raised stitching through the fabric. Just one measured breath. That was all she allowed herself. Then she went back to work. Elena stepped into Maya's room that morning with the same quiet efficiency that made her invisible. The 7-year-old was propped on pillows, her small frame drowning in hospital sheets the color of old bone. Captain Reeves stood at the window, shoulders curved inward like a man carrying invisible weight. The morning light caught the edge of his tattoo, the one on his forearm. Elena kept her gaze on her patient, on the pale lips and the slight tremor in Maya's fingers. Dr. Sterling had rounded an hour ago. Missed it. Ordered more labs. More imaging. More waiting. Elena had been standing at the bedside, checking Maya's for line, when she noticed the pattern everyone else had overlooked for 3 months. The child's symptoms didn't follow a viral path or autoimmune cascade. The timing was wrong. The presentation was too selective. Heavy metal exposure. Possibly from something in the home environment. Something chronic. Something slow. She had spoken quietly. Just an observation. Just data. Captain, has there been any renovation in your base housing? New plumbing work? Any. The door swung open. Dr. Sterling filled the frame like a man accustomed to controlling the air pressure in any room he entered. He was 41, legacy school, and his name had been embossed on the hospital's donor wall before he'd finished his residency. His composure style was old money wrapped in a white coat. Ms. Martinez. Not a greeting. A correction. A word. Elena stepped into the hallway. The fluorescent panels overhead buzzed a monotone hum. She knew what was coming before the first word left his mouth. She had seen it before, the way institutional power moved when someone from below tried to move up. The attending physicians have completed a comprehensive differential diagnosis. 20 specialists across 3 months. He let that number hang. 20. As if the weight of that number was a wall. Yet here you stand, suggesting environmental factors based on what exactly? Your extensive training in pediatric toxicology. Elena's hands were steady. Her breathing was steady. Quiet dignity meant absorbing the insult without flinching. It meant one measured breath. It meant remembering that his words were just sound waves. I've seen similar presentations. In Kandahar. Children near. Kandahar. He smiled. The kind of smile that was a blade disguised as kindness. Perhaps stick to taking temperatures, Ms. Martinez, and leave diagnostics to those with actual medical degrees. He said it at volume. Loud enough that nurses at the station 3 doors down could hear. Loud enough that Captain Reeves heard it through the open doorway. Elena had watched the captain's spine stiffen, his hand ball into a fist. But he didn't come out. He stayed with his daughter because that's what fathers do when everything else is falling apart. Sterling turned and left. The hallway settled back into its fluorescent hum. Elena took one breath. Then another. She went back to work. The break room at 3:33 p.m. was a small box with a refrigerator that smelled like 3 weeks of forgotten lunches. Elena opened her lunch container, rice and beans, prepared that morning, and sat at the long table by the corner window. The afternoon shift overlapped with evening crew, and the room was full. It was full. Until she sat down. One by one, without looking at her, the nurses gathered their containers. Martinez, who worked cardiac. Sophia, who floated between units. Ravi, who'd been kind to her since orientation. They filed out with practiced silence. The kind of silence that was choreographed. The kind that happened when a hierarchical message came from the top. Dr. Sterling had made comments in that morning's staff meeting. She'd heard about it from someone's text message. Some staff members confuse their role with the role of physicians. This kind of boundary violation creates legal liability for everyone. He hadn't said her name. He didn't have to. The message was single wavelength clear. Elena sat alone at the table. The rice was still warm. She ate it anyway. Slowly. With perfect posture. She didn't let her shoulders curve. She didn't let her breathing shift. She ate the entire meal while the refrigerator hummed and the afternoon light moved across the floor like a sundial's hand. The formal write-up was posted on the unit board at 4:27 p.m. Elena read it standing in the hallway where 20 staff members could see her reading it. The paper was standard hospital letterhead. The language was precise and bureaucratic and designed to build a case. Her name at the bottom. Dr. Sterling's signature in blue ink. Dated today. She read it twice. Once for information. Once to make sure the information was real. Then Dr. Sterling appeared. He rounded the corner with a kind of confidence that came from knowing you controlled all the exits. He expected an argument. Elena could see it in the way he'd positioned himself, not too close, but close enough to deliver another public statement if she reacted. She wiped her eyes. One tear. Just one. She didn't break eye contact with the paper. Maya deserves better than your ego, Doctor. Her voice was level. Steady. The kind of voice that came from someone who had learned, years ago, that speaking louder didn't make the truth any truer. She turned to look at him directly, and her eyes were clear. Dry now. There was something in her composure that made him step back. Some quality that suggested this conversation was over not because he'd won, but because she'd decided she was finished with it. She walked past him. Toward the supply room. Toward the medication cart. Toward the work that would continue regardless of the write-up or the public statement or the silence of nurses who were afraid to sit at a table with her. The evening shift started at 6:13 p.m. Elena was in the pediatric unit preparing evening meds when the emergency light triggered over the intercom. Not a routine code. A massive casualty notification. Military transport. Multiple personnel. Trauma Bay 1, 2, and 3. The overhead speaker crackled, all available hands to emergency department. Repeat, all available hands to emergency department. Military trauma alert incoming. Elena froze for exactly half a second. That wasn't composure. That was muscle memory responding to something primal. The sound of that notification. The words * military trauma alert star. The specific cadence of urgency. She set down the medication tray. Moved toward the emergency department with 15 other staff members. The helicopter had already landed. She could hear the rotors slowing outside. The sound, that specific percussion of rotor wash against the building, sent something through her chest like a shockwave traveling backward through time. Kandahar. FOB Shank. The difference between living and not living sometimes came down to who heard that sound and moved the fastest. Trauma Bay 1 was organized chaos. A young Marine, early 20s, with an IED injury to the lower abdomen. Blood on the floor. The distinctive coppery smell of it mixing with antiseptic. Dr. Sterling was there, and he was already making calls wrong. Hang 2 units of O negative, get an anesthesia team down here, he was pointing, barking orders, but there was panic underneath the authority. Elena could hear it. Could see it in the way his hands were moving too fast, making corrections he'd already made, like his brain was 3 seconds behind his body. The young Marine's blood pressure was dropping. Systolic already in the 70s. The monitor showed a pattern Elena recognized, cardiac tamponade. Blood in the pericardial sac. Every heartbeat was pumping against mounting pressure. The patient was drowning in his own blood. Dr. Sterling was still ordering imaging. CT angiography. Cardiothoracic consult. He was treating this like a diagnostic problem when it was already a surgical emergency. No time, Elena said. Quiet. But the words came out with different weight than they'd carried an hour ago. Pericardiocentesis. Now. Sterling turned. His face was red. Not with anger. With the specific shade that came from adrenaline mixed with the realization that he was losing control of a situation. I'm running this trauma, Ms. Martinez. Get back to. His BP is 68/40. O2 sat dropping. He's coding in for minutes if we don't needle the pericardium. Her hands had already moved to the crash cart. She wasn't making a suggestion. She wasn't asking permission. Something had shifted in her voice. Something had straightened her spine. 18-gauge needle. Betadine. Sterile field. And then the muscle memory took over. Her hands moved on their own because they had done this 1,000 times. Not in Norfolk. Not in any hospital. Under canvas in the desert with IED victims and shock and the sound of mortars falling like rain. She had held lives together with duct tape and determination and the kind of surgical precision that came from having no second chance. The syringe was in her hand. The ultrasound confirming the fluid pocket. Stop. Sterling's voice had gone small. What are you? The needle went in at the 5th intercostal space. The hiss of air escaping. Dark blood flowing into the syringe like a terrible tide going out. The monitor's rhythm shifted. The pressure on the heart releasing. O2 climbing. 62, 74. 86, sinus rhythm, someone said. A respiratory tech. Confirming what Elena's hands already knew. The Marine gasped. His color shifted from gray to something resembling human. His eyes opened. Angel, he whispered. His voice was barely there. Younger than his face. Angel 6. Elena's hands went still. That call sign. That word. She hadn't heard anyone say it in 4 years. But that wasn't the worst part. Dr. Sterling had gone white. Completely white. The kind of white that happened when someone realized they had just watched a nurse perform an emergency procedure with the precision of someone who had done it hundreds of times. Who had just saved a Marine's life with her bare hands. Who had moved with the kind of fluid confidence that came from somewhere far deeper than any hospital training. Elena didn't look at Sterling. She was already signaling for the rapid response team. Already organizing the surgical handoff. Already moving the Marine toward the OR because the initial needle had bought time but not salvation. That required surgery. That required a cardiothoracic team and operating rooms and the next 4 hours of precision medicine. She moved like a person who had never actually left the military at all. And in that moment, suspended between the fluorescent lights and the beeping monitors and the shock on Dr. Sterling's face, Elena Martinez stopped hiding. Maya's small body seized without warning. One moment she was sitting upright in the examination bed, her thin hospital gown hanging loose on her 7-year-old frame, and the next her back arched like someone had run electricity through her spine. Her lips turned blue. Then purple. The monitor above her head erupted into a screaming rhythm that filled the pediatric wing of Oak Creek Memorial like an alarm bell announcing the end of something. Elena was 3 rooms away, charting vitals on a tablet when the first code nurse sprinted past. She didn't look up. Didn't have to. 7 years of combat medicine meant she could read chaos by sound alone, the specific quality of that alarm, the pitch of the overhead pages, the way footsteps changed from hurried to panicked. She set down the tablet and moved. Not ran. Moved. The difference mattered. Running meant fear. Moving meant purpose. The pediatric room was already crowded. 3 nurses, 2 residents, a med student fumbling with equipment he didn't understand. Dr. Sterling stood in the corner, barking orders that contradicted each other. The monitor showed what her eyes already knew: ventricular fibrillation. Cardiac arrest in a 7-year-old. The electrical system of Maya's heart had simply stopped talking to the muscle. 30 seconds of this and the organ began to die. 2 minutes and the brain started to follow. Elena's hands moved before her mind caught up. Muscle memory. Combat flashback. The clinic in Kandahar where children arrived seizing from contaminated wells, their bodies shutting down from heavy metal poisoning. She'd learned to recognize the way other people recognized their own faces. She was beside the bed in 4 steps, her fingers already assessing the girl's airway, her neck, the rise and fall of her ribs. Position her supine, Elena said. Not a request. The voice came from somewhere deeper than her throat, from the place that had once commanded 23 enlisted personnel across a desert that wanted them all dead. The med student froze. Move, Elena repeated. 1 word. A command transmitted through every fiber. The student scattered and Maya lay flat against the sheets, her small chest heaving with seizure activity, her fingers clawed into fists. Dr. Sterling stepped forward, his face already red with territorial anger. Ms. Martinez, this is not your... Elena wasn't listening. Her eyes tracked the monitor, watched the chaotic spikes of a heart in electrical rebellion. She could feel the room's attention on her now, the way people instinctively recognize competence even when it arrives in scrubs and a civilian badge. She pulled on a pair of nitrile gloves with a crisp snapping sound that cut through the other noise like a gunshot. She's in V-fib with no perfusion, Elena said, moving to the bedside cart. Prepare defibrillator pads and get me a 14-gauge angiocath. Now. A nurse moved. Then another. Sterling was still talking, but his words had become background radiation, noise that mattered less than the monitor's screaming rhythm. Elena's fingers found the spot on Maya's chest between the 4th and 5th ribs, midline. The same location where she'd worked on a 3-year-old in Fallujah whose father had carried her wrapped in a blood-soaked cloth. The same place where hands that had held lives together learned that sometimes you had to go through the wall to get inside the fortress. She was already mentally running through the procedure, the 14-gauge needle, angled toward the back of the heart, threading through the pericardial sac to drain the fluid that had accumulated and was now strangling the organ from the outside. Defibrillator ready, a nurse said. Elena didn't respond. She was counting the seconds and reading the monitor at the same time. 72 seconds of arrest. The pads went on. Her hands positioned the needle with the kind of precision that comes from repetition that doesn't require thinking anymore. The angiocath gleamed under the fluorescent lights, a silver line that was about to mean the difference between a body that recovered and a body that became a memory. She advanced the needle. Felt the familiar resistance of tissue yielding. The needle passed the pericardium and she knew it the way you know when a key enters a lock, not by sight but by the subtle shift in resistance that tells you you're in the right place. Push epi, Elena said. The order went out and a nurse administered epinephrine through an existing full line. The needle was in. She attached the angiocath and pulled back on the syringe. Nothing. She repositioned slightly. Pulled again. The syringe filled with dark amber fluid. Pericardial effusion. The reason 20 doctors had missed the diagnosis. The reason Maya kept getting sicker instead of better. The contaminated water in the captain's 100-year-old base housing wasn't just poisoning her kidneys and liver, it was causing pericardial inflammation, fluid accumulation around the heart itself, slowly strangling the organ with each passing day. Elena continued to drain. 1 milliliter became 5, became 15. She could feel the pressure changing, the physical resistance against the needle softening as space opened up inside the pericardial sac. Defibrillate, Elena said. The pads delivered their shock. Maya's small body lifted from the bed in that distinctive jerking motion. Elena kept draining, kept one hand steady on the syringe while the monitor's rhythm adjusted, reorganized, moved away from the chaotic spikes of fibrillation toward something more organized. 30 seconds. 45. 60. Getting a pulse, someone whispered. Elena kept working. Pain was information. The resistance in her hand told her there was more fluid to drain. The monitor told her the rhythm was improving. The color returning to Maya's lips told her the oxygen was finally reaching where it needed to go. 75. 80. 85% oxygen saturation climbing toward normal. The numbers moved like a promise being kept. 88. 90. 92. Stable. She secured the angiocath with tape and stepped back, her breathing still controlled, her hand still steady, her expression exactly what it had been 5 minutes ago. The room was silent in the way rooms go silent when something impossible has just become undeniably real. Dr. Sterling's face had gone the color of damp concrete. He stared at Elena with an expression that suggested she'd just pulled a classified file out of the air and read it aloud in the cafeteria. His mouth opened. Closed. Opened again. You don't have the authority to. The angiocath stays in, Elena interrupted, her voice carrying the same command weight it had held 60 seconds earlier. She'll need 24 hours of monitoring before we pull it. Get toxicology. Heavy metals panel. Check the base housing water reports for lead and cadmium contamination. She was poisoned by infrastructure, not by disease. A resident nodded and moved toward the phone. Sterling stepped between Elena and the door. His hands were shaking. Not from fear. From rage. The kind of rage that arrives when the ecosystem you've built to make yourself feel important suddenly reveals itself as fragile, as dependent on everyone around you accepting your authority as natural law. You performed an emergency pericardiocentesis without a physician order, Sterling said quietly. His voice had dropped 2 octaves into dangerous territory. You drew conclusions about diagnosis without authorization. You gave direct orders to this team. You are a nurse. Not a doctor. Not a supervisor. A nurse. And you've just destroyed any credibility you had left in this hospital. Elena met his eyes. One measured breath. She let the silence sit for exactly 4 seconds while the monitor beeped its steady confirmation that a 7-year-old girl's heart was beating on its own again. She'd be dead if I'd waited for your protocols, doctor. The words landed like a knife dropped from a height. She didn't wait for his response. She simply turned and walked to the corner of the room to document what she'd done in the chart, her movements carrying the kind of calm that can only come from having already survived worse. The unit patch sewn inside her jacket lining felt like it was burning against her ribs, one more secret straining to get out. What happened next would determine everything. Dr. Sterling's face went the color of old bone when he came back to the pediatric room and found Elena standing over Maya's monitor, the little girl's chest rising and falling in steady rhythm, the blue gone from her lips, oxygen saturation climbing like it had never dropped at all. 94%. 96%. Climbing. The defibrillator pads lay on the bedside table next to a 14-gauge angiocath needle, its hub still wet. He didn't ask what had happened. He already knew. Everyone in that hallway already knew. The entire crash team had watched this nurse move like something primal and purposeful, watched her hands make a decision his 20 consulting physicians had never considered, watched her push a needle into the space around a 7-year-old's heart and pull back dark fluid that shouldn't have been there. His voice came out steady, which was somehow worse than if he'd shouted. You performed a procedure. Not a question. An accusation. Without physician authorization. Elena stepped back from the monitor, her hands already returning to normal velocity, her breathing already regulated. The patient was coding. ETA on your return was 4 minutes. She didn't have 4 minutes. She didn't add them. Didn't apologize. Just stated the facts like coordinates on a map. That procedure is not within your scope. You are a nurse, not a surgeon. He moved toward Maya's chart with the precision of someone whose entire world had just fractured, and the way he moved, deliberate, controlled, dangerous in its calmness, told Elena everything she needed to know. This wasn't about protocol anymore. This was about a man whose authority had just been unmade in front of his entire medical hierarchy by someone he had publicly called incompetent 3 hours ago. He turned to face her, and his eyes held the flat, focused quality of a predator calculating angles. You're done here. Elena met his gaze without flinching. The patient needs. You're done, he repeated, his voice the consistency of steel poured fresh. I want you removed from this unit immediately. Escort her out, he said to the security guard who had appeared in the doorway, drawn by the magnitude of what had just occurred. And file a formal report for violation of medical protocols, practice beyond scope of licensure, and insubordination. She didn't fight him. Didn't argue. Just nodded once and turned toward the door, her movements controlled, her face betraying nothing. But as she passed Captain Reeves standing in the corner of the room, his hand pressed against the wall as if the whole hospital might collapse if he let go, their eyes met for exactly 1 second. Long enough for him to see something flicker across her face. Something that reminded him of something. Of someone. But the moment was already gone. By that evening, Elena was escorted through the main corridor of Oak Creek Memorial with a manila folder pressed against her chest and her badge already removed from her scrubs. The walk to the exit felt like moving through water, each step deliberate, each breath counted. Nurses whispered. Someone's phone was already out, already recording. Dr. Sterling was still in the hospital somewhere, already making calls, already activating the machinery of institutional power. She could feel it the way you feel a storm gathering, not seeing it yet, but knowing the pressure had changed. His first call came at 7:41 p.m. to the hospital board president during dinner, his voice measured and precise as surgical steel. "Yes, I'm aware it's evening. This is time-sensitive. One of our nursing staff performed an unauthorized pericardiocentesis on a pediatric patient today. Cardiac tamponade. Yes, the patient survived, but that's not the point. The point is the complete breakdown of protocol, the liability, the danger. We need an official investigation. I'm documenting everything." The second call came at 8:15 p.m. to Elena's previous employer, a large civilian hospital system in San Diego, where she'd worked for 4 years before the PTSD became a weight she couldn't carry anymore and she'd walked away without explanation. "This is Dr. James Sterling, Chief of Medicine at Oak Creek Memorial in Norfolk. I'm calling regarding a former employee, Elena Martinez." "Yes, I have the correct spelling. I'm investigating some concerns about her licensure and professional judgment, and I'd appreciate any information you might have regarding her tenure with you. Anything at all. Gaps in employment, performance issues, behavioral concerns." The third mechanism activated at 8:42 p.m. when the State Nursing Board received a formal complaint about an unlicensed procedure, accompanied by Dr. Sterling's detailed narrative and what he described as a pattern of concerning judgment calls that the institution has tolerated too long. Elena drove in absolute silence to the Norfolk VA hospital, a sprawling complex of grey buildings where she'd once held rank, where she'd once made decisions that determined whether men lived or died, where she'd been the one trusted with life and death instead of temperature checks and bedpan logistics. The rain had started somewhere between Oak Creek and here, soft at first and then harder, tapping against her windshield like Morse code she'd forgotten how to read. She sat in the waiting room at 9:13 p.m. with an intake form in her hands and a pen that felt like it weighed 1,000 pounds. Among the veterans in the plastic chairs around her, a missing leg, a scarred face, a man who wouldn't make eye contact with anyone, were 3 she recognized from the unit. They didn't recognize her. That was the whole point. She'd spent for years making sure they wouldn't. Name, Elena Martinez. Rank, civilian. Service branch, none. Chief complaint, PTSD, acute destabilization. The words blurred. Her hands were shaking now, trembling like someone had cut the cables holding her upright. She steadied them by pressing them flat against the form. "Don't cry. Soldiers don't cry. Not here. Not in front of the men you used to command." The waiting room television showed the 10 p.m. news. Captain Reeves stood at a microphone in front of Oak Creek Memorial, his dress uniform pressed sharp enough to cut, Maya in a wheelchair beside him looking small and papery in the hospital lighting. "We came to Norfolk seeking answers," he said, his voice steady but raw at the edges. "My daughter was failing. 20 different specialists, 3 months of testing, and nothing. Today, due to the exceptional medical expertise of Dr. James Sterling and his environmental investigation team, we learned that heavy metal contamination in our base housing was the cause. Dr. Sterling identified this through rigorous diagnostic protocol and potentially saved my daughter's life." Dr. Sterling stood behind him, nodding, accepting the gratitude that wasn't his to accept, his face already composing the story he would tell forever about the nurse who overstepped and the doctor who cleaned up the mess. Elena's eyes stayed on the screen. Her hand went inside her jacket without her making a conscious decision to do it, found the faded unit patch sewn into the lining, colors worn pale from years of being carried against her ribs, the insignia of the unit she'd commanded in Kandahar now feeling like it was burning against her skin like a brand. The room swam. For a second, just a second, she thought about the trash can in the corner and how easy it would be to walk over there and drop it in. How easy it would be to let go of everything. How much simpler everything would be if she'd never existed at all. Her hand shook so badly she could barely write her name on the intake form. Elena Martinez. Not Senior Chief Elena Martinez. Not the woman who'd carried Captain Reeves bleeding into a medevac while artillery screamed overhead. Just Elena Martinez, nurse, now patient, now invisible again but in a different way. This invisibility wasn't safety. This invisibility was erasure. The intake nurse, a young woman, maybe 26, maybe never seen real combat, called her name and led her back to a small room with a poster about veteran mental health resources and a chair that faced a window looking out onto the parking lot where rain hammered the asphalt. "Your symptoms started when?" the nurse asked. "Pen ready." "This afternoon," Elena said quietly. "And before that?" Elena didn't answer. Before that was 8 years of pretending to be smaller than she was. 8 years of swallowing who she'd been so thoroughly that even she'd almost believed it. 8 years of carrying a unit patch inside her jacket like a secret she was slowly burying alive. The nurse kept writing. Outside, somewhere beyond the rain and beyond the lights of the parking lot, there was a sound. Not yet close enough to matter. Not yet loud enough to change anything. But it was there. A distant sound that made Elena's head lift slightly, the way an animal lifts its head when it hears something approaching from far away. A rhythmic sound. A sound like rotors. The helicopter rotors cut through the rain like the sound of her own heartbeat finally acknowledging it was still alive. Elena sat in the Norfolk VA waiting room, intake forms trembling in her hands, not from fear, but from the familiar weight of surrender. The fluorescent lights above cast everything in that particular shade of institutional beige that smelled like antiseptic and the ghosts of every soldier who'd sat in this exact chair before her. She hadn't written her name yet. Senior Chief Petty Officer Elena Martinez. The words felt like they belonged to someone else now, someone buried under 3 months of civilian scrubs and the careful practice of invisibility. The pencil hovered above the blank line when the doors burst open. 2 figures in dress uniforms moved through the waiting room like the air pressure itself had changed around them. Captain James Reeves, his dress blues immaculate, his face carved from the kind of grief that comes from watching your child slip toward diagnosis number 21 with no answers. And beside him, small, pale, but moving under her own power, 7-year-old Maya Reeves in a hospital gown, her footpole rolling beside her like a metal ghost. Behind them, a Fox News camera crew assembled with the efficiency of a strike team, lights clicking to life, the red recording light staring like predatory eyes. The waiting room fell silent. Every veteran there recognized the gravity of what was about to happen. There was no small talk in a space where rank still mattered, where uniforms still commanded the kind of attention that made ordinary people sit straighter. Captain Reeves wasn't looking at the other patients. He was scanning the room, searching, his jaw set in the way men's jaws set when they're about to do something that matters. The camera operator positioned himself in the corner, catching light angles, framing the moment. This wasn't accidental. This was orchestrated. Intentional. This was a man bringing his daughter into a hospital to bear witness to something she'd seen but no one had believed. Maya's small hand gripped her father's with the ferocity of a child who'd learned in 7 years that doctors missed things, that sometimes the smallest voice in the room was the only one telling the truth. Elena stood without deciding to stand. Her body had received orders older than her conscious mind, and those orders said move. She folded the intake forms in half and placed them on the empty plastic chair beside her. The movement caught Maya's eyes like a bell ringing in a cathedral. The little girl's head turned. Her hand tightened on her father's jacket. And then she spoke in a voice that sounded like wind chimes in a hurricane, fragile and clear and absolutely certain. "That's her. That's the nurse who saved me. She's Senior Chief." The room didn't just go quiet. The room inverted. Every sound in it, the ambient hum of hospital machinery, the shuffle of camera feet, the breathing of witnesses, pulled inward like the moment before a thunderstorm breaks. Captain Reeves' head turned. His eyes found Elena across 30 feet of waiting room tile and held her there like she was a ghost that had just become corporeal. His hand moved unconsciously to his left forearm, the tattoo that lived under his dress sleeve, the name he'd carried from Kandahar, from the moment she'd hoisted 200 pounds of bleeding Marine onto her shoulders and walked him toward the medevac rotors while rounds snapped past her ear like angry insects. He'd never seen her face without dust and blood. Never heard her voice without the rotor wash drowning everything but the animal sound of a soldier carrying another soldier back to life. She looked different now. Smaller, maybe. The haircut civilian short instead of military tight. The posture almost deferential if you weren't looking carefully enough to see the way her weight sat centered, ready, the way a cobra sits ready, not tense, but precisely calibrated. The hospital security officer who'd escorted her to collect her personal belongings from the locker room stood 5 feet behind her, his hand still half raised from walking her toward the exit. The forms for the ethics investigation were still in her jacket pocket. The suspension notice was already processing through state channels. She was supposed to be leaving. She was supposed to disappear quietly the way she'd learned to disappear quietly. But Maya's voice had changed the equation. One small girl's memory, solid and unmistakable as a diagnosis. A man in Navy uniform stepped from behind Captain Reeves, a rear admiral with stars that caught the fluorescent light and threw it back like a weapon. His face was weathered the way faces become weathered when they've made decisions that cost lives and saved lives in approximately equal measure. He carried a manila folder that looked like it weighed 300 pounds, though it was probably 4 ounces at most. Behind him, visible through the waiting room phone mounted on the wall, another face appeared on the screen, Admiral Sarah Chen, Commander of Naval Medical Command, a uniform crisp enough to cut glass, her eyes the color of someone who'd reviewed intelligence briefings for 30 years and forgotten how to be shocked by anything except valor. The rear admiral's hands trembled as he opened the folder. Not from fear. From the particular tremor that comes from reading citations aloud to the person who'd earned them, the recognition arriving 7 years late and in a hospital waiting room with news cameras rolling. His voice cracked on the second sentence. Navy Cross. Citation reads, for extraordinary heroism while serving in direct support of combat operations in Kandahar province. Senior Chief Martinez provided emergency medical intervention under direct fire, saving the lives of 15 service members and refusing evacuation despite sustaining multiple wounds. Elena didn't move. Her composure was a thing she'd built stone by stone in a military hospital, in physical therapy, in the months of therapy sessions where her PTSD had learned to sit across from her in a civilian chair and introduce itself by its true name. She watched the rear admiral's hands move to the next document. Purple Heart. First award, 2015. A pause. A breath. Purple Heart. Second award, 2016. Another pause. The camera operator's hand was shaking. The notebook of whatever correspondent had been standing nearby was now hanging at his side, forgotten, because this wasn't a story about a hospital anymore. This was a story about rank. About service. About everything the Navy had taught her that the hospital's walls had tried to silence. Silver Star. Citation reads, for gallantry in action while exposed to enemy fire, Senior Chief Martinez coordinated emergency response protocols that resulted in the rescue of 14 Marines and 1 Army medic from a tactical situation that was assessed as unrecoverable. Through the waiting room phone, Admiral Chen's voice came clear and steady, the way a voice comes when the person speaking has authority written into their very bone structure. Her service record shows 23 years and 4 months of active duty. 2 deployments to Iraq. For deployments to Afghanistan. She held the rank of Senior Chief Petty Officer in Naval Medical Command. She was medically retired due to service-connected disability, but her discharge was voluntary. She could have remained in uniform. Dr. Sterling had walked into the waiting room sometime during the medal recitations. Elena hadn't heard him arrive, she'd been too busy watching Captain Reeves' face as the pieces clicked into place, as his hand on his forearm confirmed what his eyes had finally recognized. Sterling's face went the color of old concrete. The kind of color a face goes when institutional authority suddenly means nothing because actual authority has just walked into the room wearing stars and dress blues, and the kind of composure that comes from commanding human beings in actual life-or-death situations instead of just managing their insurance approvals. The hospital board president, a man named Marcus Holloway, himself a Marine veteran with 20 years of service and the kind of quiet that commands rooms without needing to speak, stepped forward with a document in his hand. His voice, when it came, was the voice of someone who understood exactly what Elena had done and exactly what Sterling had attempted to do in response. It was the voice of betrayal recognized. "Dr. David Sterling, you are hereby terminated from your position as Chief of Medicine at Oak Creek Memorial, effective immediately. Your administrative privileges are suspended pending investigation by both the State Medical Board and the Department of Defense. Your actions in this institution have resulted in delayed diagnosis, patient harm, and institutional violation of the fundamental principle that the voices of experienced nursing staff are integral to patient safety." Sterling's mouth opened. He looked like a man trying to speak underwater. Captain Reeves was moving toward Elena now, his daughter's hand still in his, the cameras pivoting to follow them. The Rear Admiral was already extending his hand in a gesture that meant more than a handshake. It meant recognition, it meant apology on behalf of the institution that had let her slip away, it meant welcome home. "Senior Chief, it's an honor to have you back." But that wasn't the story. The story would come later, in the way stories always come when you've let a predator think he could rebuild his authority in the wreckage of his reputation. 6 months later, Elena would hear through the nursing grapevine that Dr. Sterling had taken a position teaching CPR fundamentals at a community college in Tucson, Arizona. The job paid $17 an hour. The name tag he wore read, Steve. His medical license hung suspended, not revoked, not yet, but suspended in a state that felt worse than finality because it was temporary, which meant he had to keep hoping for reinstatement that would never come. 3 of his former patients had filed malpractice suits. The state was investigating 14 cases where his diagnoses had been documented by nursing staff as potentially inaccurate, but his authority had silenced them. When someone called him doctor, he flinched. But that wasn't the ending either. The ending came on a September afternoon in Norfolk, sunlight pooling golden on the deck of the Reeves house, the kind of house that has a fence and a yard that smells like someone actually lives there instead of just exists in it. Elena wore her dress uniform for the first time in 3 years, khaki and pressed, the ribbon sitting over her left chest like a map of every place she'd been and every moment she'd rather forget. Maya ran toward her across the grass, no fur pole, no hospital gown, just a 7-year-old in a sundress that matched the color of her recovery. Her 9th birthday. The party was small: Captain Reeves, his ex-wife, Maya's grandmother, a handful of their actual friends. Not the hospital people. Not the official people. Just the people who mattered. Captain Reeves introduced her to his family in a voice steady as stone. "This is Senior Chief Martinez. She saved my life in Kandahar. And she saved Maya's life here." He paused. His hand found Elena's shoulder in a gesture that meant everything. "She's family. She'll always be family." Maya's small hand reached out and took Elena's, the way children do when they're certain about something. The way Maya had been certain in a hospital waiting room when no one else could hear the truth anymore. Elena looked at the gathered people, at Reeves' family, at his daughter's face bright with health and recognition, at the September light that made everything look like it had been remade new. She thought about the intake forms she'd never finished in the VA hospital. She thought about the unit patch sewn into her jacket lining, no longer hidden. She thought about the message that had come 3 weeks earlier from Admiral Chen offering her a position as Director of Trauma Services at Naval Medical Command, a position that came with authority and respect and the permission to actually be seen. But standing in that yard, watching Maya press against her side, Elena knew the real answer had nothing to do with titles. She was still a nurse. Still someone who showed up when people were breaking. Still someone who knew that the smallest voice in the room sometimes carried the most important truth. The uniform was just permission to be heard. The rank was just language for what she'd always been, someone worth listening to. "Did I ever tell you about the time your dad tried to walk to the medevac on a shattered femur?" Elena asked Maya, and the little girl's eyes widened with the hunger children have for real stories, the kind that matter. Captain Reeves laughed, a real laugh, the kind that doesn't come out unless something in the world has been put right. This is what Elena had walked away from the Navy to find, not anonymity, but actually being seen. Not safety, but purpose. Not hiding her medals, but standing in sunlight with a child who'd been saved by the same hands that had once held the line in Kandahar. Her fight was here now. In the small moments. In the voices no one was listening to. In the children who needed an adult to believe them when their bodies were telling stories that 20 doctors had collectively failed to hear. Over the following months, Oak Creek Memorial implemented new protocols. Nursing staff diagnostic input became mandatory in complex cases. Cross-disciplinary care teams were established. Formal protections were created for staff who identified potentially missed diagnoses. The reform spread. Other hospitals in Virginia began implementing similar changes. By the following year, healthcare systems across the country had started redesigning their structures to ensure that experience at the bedside, the presence of someone who'd actually held the trembling hands, who'd witnessed the pattern over decades instead of minutes, would never be silenced again by the architecture of hierarchy. The trembling wasn't fear. It was restraint. All those months of silence, all those months of invisible service, all the weight of being right but unheard had compressed into a single moment of clarity, that the greatest power isn't the power to be heard. It's the power to hear, to actually listen to the person standing next to you, to believe them when they see something that challenges your authority, to choose growth over ego every single time. Not all heroes wear capes. Some wear scrubs. If you've ever been silenced when you were right, if you've ever had your voice dismissed by someone with more credentials but less wisdom, subscribe for more stories about what happens when quiet people finally get to speak. What would you have done if you'd been in Elena's position? Would you have kept quiet to protect your job, or would you have fought for the patient? Comment below. And like this video if you believe that real authority means listening to everyone, regardless of their title.